Today I'll be talking about loperamide. Now we must know that loperamide is one of the most effective medicine against diarrhea. So if it is basically opioid or opiate analog, the dosage of loperamide is it comes into 2 milligram tablet. So you can give two tablets start, you can give 4 milligram if loose motion is significantly there. Or usually it can be given for 1 to 2 days, 2 milligram three times a day for a day or two. It is always for very short duration, mostly for a day or two or three maximum. Now, it does not cross blood-brain barrier very well. So, it acts on peripheral mu opioid receptor that is at enteric neurons, that is at intestine, and it also has an additional weak anticholinergic properties which are actually beneficial for the loose motions. Now, it also has a direct action on intestinal smooth muscles, and it also affects the secretory and absorptive epithelium as well. So, I'll come to that later. The duration of action of this loperamide is around 12 hours. Very commonly, it can be given twice a day or thrice a day for a day or two. Now, it increases the small bowel tone. It markedly reduces the propulsive movement of the gut. That is how it reduces the loose motions. It also reduces the intestinal secretions and it increases the absorption of the water and other nutrients so that the loss of these electrolytes through the loose motions markedly reduce and the loose motion frequency improves a lot. It is for only for symptomatic relief in diarrhea, just to reduce the number of loose motions. It doesn't have any antibacterial or any other properties. It also improves the fecal continence by enhancing the anal sphincter tone. So this property can be used for those patients who are elderly and who have increased stool frequency because of the loose anal sphincter tone. Now, you must know that this is not used at all in a child of less than 4 years of age, and it is one of the most effective anti-motility, anti-diarrhea drug that we know. We should use this medicine only if the loose motion is exhaustive. Suppose if the patient is having loose motion of like 7 times, 8 times, 9 times, 10 times, 12 times, mean of the time patient come with like 20 loose motions, 30 loose motions. So this is so much exhausting that causes so much of loss of water, electrolytes. So to prevent that exhausting diarrhea, we definitely use loperamide, and it has to be used only for short term, like for a day or two, maximum like 2 to 3 days. This is absorbed very much little in intestine. That is the reason why it acts on this at peripheral level. So it is absorbed very little and the entry into the brain is negligible. That is how the central effects of this loperamide is extremely less. It has no abuse liability, and the most important side effect of this medicine is paralytic ileus, abdominal distension, and toxic megacolon. It reduces loose motions, so it can increase the nausea and vomiting. So you have to make sure that patient doesn't have nausea, vomiting. If patient has nausea, vomiting, then we should preferably reduce the loperamide dosage. We have to make sure that the patient doesn't have nausea, vomiting. The most common dosage which is used is 2 milligram. Very commonly, three times a day can be given for a day or two. To stop the loose motions immediately as soon as possible, 2 milligram, two tablets can be given stat, and it can be followed with 2 milligram three times a day dosage. Thank you.